Welcome dear students. I am Richa Shakya, Assistant Professor from Noida Institute of Engineering Technology, Pharmacy Institute, Greater Noida. Today I am here to deliver the lecture from the subject that is of Pathophysiology, and the subject code is BP204T, and this subject comes under the Dr. APJ Abdul Kalam Technical University. So, today's topic is the introduction of hepatitis. So, there is a various kinds of hepatitis. There is hepatitis A, B, C, D, E and F. So, these are the introduction of the hepatitis, types of hepatitis, and last one is the alcohol liver disease. So, in this topic we learn about what is hepatitis, what is the classification of the hepatitis, what is the causes of this hepatitis, and what is the causes and the treatment for the ALD, that is the alcohol liver disease. Now, we start with the introductory part of the hepatitis. So, first of all, when we talk about the hepatitis, right, hepatitis means hepato which term which means the liver. Okay? So, liver resembles with the term hepatitis, hepato, and whenever the inflammation in the liver, that terms is known as the hepatitis, right. So, there is a various causes of the hepatitis. There is a major causes of the hepatitis A, B, C, D, E and F. There is various classifications. Now, so in the introduction of the hepatitis, so hepatitis refers, it is an inflammatory condition of the liver, and it is commonly the result of the viral infections. So, if we talk about the hepatitis, there are viral infections. So, basically these are caused just because of the viral infections, but there are other possible causes of hepatitis may also, just like in the last lecture we talk about the jaundice. So, there is a jaundice, there is a inflammation of the liver just because of the various kinds of processes. So, this hepatitis is basically caused by the virus. Now, this includes the autoimmune hepatitis that occurs the secondary results of the medications, right. So, this hepatitis may also just because of the uses of the different kind of medicines, drugs or some toxic substance and excess intake of the alcohol, right. So, this hepatitis, there is some possible causes, that is the some uses of the drug just like NSAID drug, NSAIDs, non-steroidal anti-inflammatory drugs, right, toxins and excess amount of alcohol intake. Now, autoimmune hepatitis is a disease that occurs when the body makes antibodies against your liver tissues, right. Means what is the function of autoimmune system? Means they perform the self defense mechanism. But what happened at that time, autoimmune hepatitis, what happened at that time, the antibodies perform against their liver tissues. They damage their liver tissues as they find the liver tissues as their danger agents. So, they attack on that. So, there is an autoimmune hepatitis. There is a 5 main types of the hepatitis: hepatitis A, B, C, D, E. Okay? Hepatitis A. So, A different virus responsible for each type of hepatitis. Means every kind of the hepatitis, every different parts or different types of the viral hepatitis caused by the various type of the viruses. So, hepatitis is the inflammation of the liver, and this inflammation is just because of the swelling that happens when the tissue of the body are injured or infected, and it can damage the liver. So, this swelling and damage can affect how well the liver will functioning, and hepatitis can be acute or chronic. It may be acute, acute means it's a short term, or chronic means it's the long term. Whenever the person is suffering from the long term hepatitis, they cause the liver cancers. Now, hepatitis viruses just like A, B, C, D. So, we denote as a HAV. HAV, what is HAV? Hepatitis A virus, HAV, right? Hepatitis B, HBV, HCV, HDV, which requires the co-consisting as the HBV infections, and HEV cause the majority of the clinical causes of the viral infections. So, these are the viral infections that are only hepatitis virus of the endemic to the United States, whereas HAV and HBV are common cause of the acute hepatitis in the United States, and SCV is the most common chronic hepatitis. Means hepatitis C is the most common and the most chronic disease, right? And there is no treatment, and there is no properly cure of that particular HCV virus. Now, there is a types of virus. So the term viral hepatitis is caused to describe the infections of the liver just because of the viruses which occurs into the particularly in the liver cells, into the hepatic cells. So currently there are the 5 main varieties of these viruses which cause a distinct type of the viral hepatitis. These are the hepatitis A virus, B, C, D and E virus. D is known as the delta virus. Now, there are the 3 stages of the symptoms. If we talk about what is the types of hepatitis, so there are the 3 stages of the symptoms, that is a prodromal, ectric or convalescent. So, it is based on the phase of patient where it will stay. Okay? So, these prodromal, ectric I already told you that is it is known as the icterus fever. Icterus fever is also known as a jaundice, right? So, these all are symptoms occurs persons to person, their effectiveness, then how much the person is effective at that particular disease. Now, in the prodromal stage, the virus in the blood and will release the chemicals, that is a prodromal stage, and these chemicals will create the symptoms such as fever, headache, fatigueness, vomiting, skin rashes and the joint pains. So, this is the prodromal stage. Now, ectric stage, so this is a conjugated bilirubin, right? So, this is the just it is related with the jaundice. So, it is in this ectric stage, the conjugated bases or bilirubin are transaminase spills into the bloodstream which cause the damage of the bile duct and the hepatocytes, and this conjugated and unconjugated bilirubin makes the patients appear yellowish just because of the content of the bilirubin is still in the bloodstream. They can't excrete out from the body stream, from the body or from with the help of the stools, right? They can't excrete out. The person shows the yellowish color of the skin or the eye. The presence of dark urine and the presence of the dark urine, the liver may liver may become the enlarged. This is the stage as well as which the term is known as the hepatomegaly. Hepatomegaly means the liver cells get enlarged just because of inflammation. So, that term is known as the hepatomegaly. Megaly means there is a large. Now, last one is the convalescent stage. So, convalescent stages that symptoms becomes better than the patient return to the normal. Now, there are various types of hepatitis. We talk about the one by one. So, hepatitis A, this is the first virus, that is hepatitis A. So, hepatitis A virus is a result, the infection which with the hepatitis A virus, and this hepatitis is the acute is a short term, right? Acute disease, Hepatitis A, also known as the hepatitis A or HAV, and is a part and is a group of the hepatitis A virus which attack on the liver, right. So these specific type of virus which attack on the liver, that is known as hepatitis virus, and this is the first is hepatitis A. Now it is more common in the place of poor sanitization or hygiene condition and the lack of the clean. However, it is also passed through the unprotected sex and the by the sharing of the needles. So these are the most common uh, places where this hepatitis A will spread. It is spread with the poor sanitization, with the poor hygienic conditions, and with the unprotected sex or the sharing of the uses of needles. So if the person is already suffer from the this hepatitis A and the person is sharing the needle to the healthy person, the person is already affected. Now hepatitis A is not a serious and clear up only its own after to the 10 to 14 days. So the incubation period is about 10 to 14 days. So this it will automatically overcome. Now symptoms, it's a flu like symptom, just like including the tiredness, fever, ache and the pain, loss of appetite, feeling being sick, diarrhea, pain in the upper part of the abdomen, dark urine or the pale fecal or the pale stools, yellow of the skin and the eyes, just like in the jaundice condition, and the itchy skins. This is the condition of the hepatitis A. Now hepatitis B. So hepatitis B is also known as the Hep V or HVB. So this is a part of the group of hepatitis virus that again attack with the liver, and it is caused with by the unprotected sex through the contaminated use of the needles, pregnant women to their babies during the birth. Vaccination of the virus hepatitis B is routinely offered to the infants. So during there are several kinds of vaccinations. There is a one vaccination of hepatitis B. It will offer to the infants, so that the infants will not get affected to this kind of virus. Now adults that have the higher risk to getting hepatitis B may also afford to the get vaccinated with against this virus. The hepatitis B does not always cause the symptoms and can pass in a few months without any treatment, that is acute infections. People can have the lifelong infection, that is a chronic, and without appropriate treatment it can become the more serious. Now if we talk about the symptoms just like the hepatitis A, it is a flu like symptoms including tiredness, fever, ache and the pain, loss of appetite, loss of weight, abdominal pain, diarrhea, jaundice, dark urine or the pale fecal or the yellow color of stools. Now hepatitis C. So hepatitis C, also known as the Hep C or hepatitis or HCV, and this is a part of the hepatitis which again attack on the liver, and this is the very serious and very dangerous kind of the virus. Now it is mainly passed through the contaminated needles, either from the injected drugs from the or from the needles stick injuries to the healthcare settings. It can also transmitted with the unprotected cells, especially in the anal or the types of the sex that are involved in the blood. Now chronic hepatitis C can be serious, and without appropriate treatment it can cause the liver disease, entire liver disease, or this may cause the liver cancer, right, which leads to the death. And the treatment where available, there is a cure of the hepatitis is more in the most cases. So there is a not properly treatment occur, but there is a some cure with the hepatitis C. So there are the symptoms of hepatitis C, which includes the mental confusion, uh, and depression. Constantly the person which is who is suffering from the hepatitis C, they continuously feel tired, and nausea, vomiting, and abdominal pain, dark urine, pale skin, dark stools, jaundice, itchy skin, feeling bloated into the stomach area, into the abdominal area, joint and muscle pain. These are the common symptoms with the hepatitis C. Now, next is the hepatitis D. It is defective single strand of RNA and usually occurs with the hepatitis B. It is resembled with the hepatitis B. So, it can spread parenterally from spread from the parenterally. Drug users have the most risk to this kind of the hepatitis D. Now, it could be a severe or leads to the liver failure, and the treatment with the pegylated, that is a pegylated interferons alpha, and the treatment has highly failure at the this is denoted by the McCain and the Hitter. Now, hepatitis E. So, this hepatitis E is the RNA virus, and it is in a family of the Hepatitis. Okay. So, this hepatitis E is the RNA virus, and it comes in the family of Hepatitis, and it has the 50 days of incubation. As I told you, in the incubation period of the hepatitis A, it is a 10 to 14 days, but there is the incubation period of the hepatitis E virus, it is about 50 days. Okay, 50 days of incubation period. It is spread by the fecal oral route through the contamination water and uncooked meat. So, it is again with the help of just because of poor sanitization or poor hygiene. So, this is the major cause of the hepatitis E. Now, severity is mild, and this disease usually not chronic, but if it gets serious, it leads to the acute liver failure or of the chronic hepatitis. Means this is not more severe as the hepatitis C, but whenever it becomes chronic, they cause the liver failure. Now, it resembles the hepatitis A, but could not have the asymptomatic. It can produce the neurological symptoms and impairment of the kidney functions, and this treatment is with the ribavirin and the pegylated interferons alpha. So, these are the treatments which there is a drug. So, there is a treatment used for the hepatitis A. Now, pathophysiology, if we talk about the what is the pathophysiology behind this hepatitis. So, there is a various kinds of the HBV infection, that is a HBV, there is a hepatitis V infections. So, there is a acute hepatitis or the chronic hepatitis. So, when it is a acute, they just killing the viruses of the infected cell and which cause the liver damage. And now, if we talk about, so now chronic hepatitis is the parasites of the replication, insufficient clearance of the viruses, cells. Now, malignant cancer which is uncontrolled and which may cause the cancer, right. So, there is a regulation, there is a upregulation which cause the spike, SPIK spike, and which is a suppression which cause the immune surveillance mediated the CTL and NK pathways, which by the enzyme, that is a GZMA, which causes the killing of the virus, which is cause the infected virus, and due to this acute hepatitis will healed. So, hepatitis A disease The viral hepatitis disease initially affect the liver. Hepatitis has a several routes of transmission and comes with a several different forms such as hepatitis A, B, C, D, E, and this virus enters the bloodstream and is spread into the liver that affect the hepatocytes and the multiply. They change the antigens structure of the virus site. The body beings to use self medicated immune autoimmune responses and attempting the damage of the hepatocytes. Now in the hepatocytes B and C that can continue in the process of overall over the years, right. Now hepatic jaundice. So hepatic jaundice means just because of icterus, right. So the following is a typical patterns which is the hepatic viruses are transmitted, just like the there are different types of the viruses. There is a mode of the transmissions. What is the mode of transmission? That is a HIV virus, means it is just because of the fecal or oral transmission, parenteral transmission, and HV virus is a parenteral transmission, sexual transmission, perinatal transmission, and there is a unknown transmissions. Now last one is the hepatitis. Next one is hepatitis C, which is just because of sexual transmission, prenatal transmission or unknown transmissions, and then HDV, that is the prenatal, sexual, and the prenatal. HEV is the just because of poor hygiene prenatals. So these are the different kinds of the liver hepatitis which can occur the different conditions. Now this is all about the hepatitis. There are various kinds of the hepatitis. Now the next topic is the alcohol liver disease. What is alcohol liver disease? As the known as the alcoholic. Alcoholic means the excess amount of the intake of the alcohol, and this cause the liver damage, right. So alcohol liver disease is a common but can be prevented. So there is a 3 types of alcohol liver disease, and many it is just because of many heavy drinkers progress through the 3 types of the overtime, just like it. The first causes of this alcoholic liver disease is the fatty liver, right. So fatty liver is the buildup of fat inside the liver cells which leads the enlargement of the liver, that is a hepatomegaly, and this is the common alcoholic induced liver problem, right. So fatty liver disease means fatty liver. First of all, there is a excess amount of fat deposited into the liver, and just because of excess amount of fat deposited into the liver will increase their size, and this enlargement of the liver is known as a hepatomegaly. Now next is the alcoholic hepatitis. The alcoholic hepatitis is an acute inflammation of the liver. There is a death of the liver cells, or there is a killing, or there is a damage of the liver cells, often followed by the permanent scarring, and this permanent scarring is known as the liver cirrhosis. That is a liver cirrhosis. Now this liver cirrhosis, so this liver cirrhosis is the destruction of the normal liver tissues. It leaves the scarce tissues in the place of the working liver tissues. So there is a liver cirrhosis. Now metabolism of the alcohol. So how the alcohol will get metabolized into the liver? So first of all, it is taken in the form of the ethanol, and this ethanol is oxidized, and in the presence of the alcohol dehydrogenase, okay, there is ADH and CYP, that is a catalase. So it forms the acetaldehyde, ठीक है, and this acetaldehyde converts the acetic acid with the help of the acetaldehyde dehydrogenase. So, this acetic acid, this acetaldehyde converts to the acetic acid just because of the acetaldehyde, right. Now, this acetic acid again convert into the acetyl coenzyme and this enter to the citric acid cycle. So, this is just because of acetyl coenzyme A synthetases, and this is a tetraisoquinone TIQS. So, this is the metabolism of the alcohol. Now, next one, how the alcohol liver disease will occur. So, building up of the fluids into the abdominal, that is the ascites, yellowing of the skin or the eye, that is a jaundice, spider like appearance of the blood vessels on the skin, chest swelling and shrinking of the testicle in the men, ease brushing of the bleeding and the pale stools. So, they are the common symptoms of the alcohol liver disease, and this is the condition. First is non-transmissible liver disease caused due to the excessive intake of alcohol. The chronicity ranges from the harmless and reversible to the alcohol liver disease to the alcoholic liver cirrhosis. Prevention: stop drinking too much, stop the taking too much. Now, symptoms: dry mouth, increased thirst, abdominal pain and swelling, yellowing of the eye or the skin, weight loss, and risk factor is alcohol abuse. Now, this is the alcohol liver disease pathophysiology, how the alcohol ALD will occur. Now, this alcohol with the help of acetaldehyde dehydrogenase, so it convert into the acetaldehyde. So, this NAD convert to the NADH, and this ALDH with the help of this ALDH is convert to the acetate. This NADH convert to the NADH. Now, this is a diagram which shows the healthy liver. If the person is taking continuously the intake of the high consumption of the alcohol, the liver will first case condition is the liver will become fatty, right. The liver will become fatty. Next is, it is about less than 90% of heavy drinkers. Now, alcohol liver disease, it is 10 to 35% of heavy drinkers, heavy consumption of the alcohol, and last one is cirrhosis, which is 10 to 20% of heavy drinkers. Means this is a condition, this is a healthy stomach, so healthy liver. Now, fatty liver, hepatitis, and last one is a cirrhosis, where all over the liver cells will get damaged. Now, alcohol liver disease diagnosed with the blood test, liver biopsy, ultrasounds, CT scans or MRIs. They are the various types of the test which is performed. Blood test, again CBC, complete blood count test. Now, liver biopsy, so in this what happened at that time, they take the sample, take tissue sample for diagnosis. Right. So, ultrasound में क्या होगा, what occurs in the ultrasound? Imaging of liver damaged tissue, right. CT scan में again the same thing. In the MRI again they are the imaging. So, these are the diagnosis, these are the diagnosis of ALD, right. So, this is all about the ALD. Thank you.